How do euthanasia debates shape end-of-life care decisions? Imagine facing a choice where life and death hang in the balance. Euthanasia debates influence how society and medical professionals approach these tough decisions. These discussions focus on what is morally right when it comes to ending suffering. They shape laws, medical guidelines, and how doctors and patients work together during difficult times. At the heart of these debates is the idea of autonomy. This means that competent individuals should have the right to decide how and when they want to die. People who support euthanasia believe that allowing patients to choose death in cases of unbearable pain respects their dignity and control. They see it as a compassionate way to end suffering and improve quality of life at the very end. Opponents of euthanasia often emphasize the sanctity of life. They argue that every life has value, no matter how much pain a person is in. They believe that intentionally ending a life is morally wrong, even if it seems kind. Many refer to ethical principles that say life should be preserved whenever possible, and that taking life could lead to dangerous slippery slopes. They worry about potential misuse or pressure on vulnerable people. The debate also involves the difference between active euthanasia and passive euthanasia. Active euthanasia means directly causing death, like giving a lethal dose of medication. Passive euthanasia involves stopping treatments or life support that keep someone alive. Some argue there is no moral difference if the goal is to respect patient wishes and reduce suffering. Others believe actively ending a life is a more serious moral issue. These ethical views influence real-world decisions. When euthanasia is legal, strict rules often requiring patients to be fully competent, make voluntary choices, and experience unbearable suffering. Medical professionals must balance their duty to do good with their obligation to do no harm. They also have to consider the patient's wishes versus medical opinions about prognosis. In the end, these debates shape how society views the morality of hastening death versus letting natural death happen. They highlight the importance of respecting individual choices and dignity at the end of life. They also influence laws and medical practices that guide how doctors and families make these difficult decisions. So, the ongoing conversations about euthanasia help define what is acceptable and what is not when it comes to ending life. They challenge us to think about how we value suffering, autonomy, and the moral limits of medical intervention. These debates keep society questioning how best to care for people facing their final days.